this episode of the Mama Podcast, we are joined by Jane Plumb, the CEO and founder of Group B Strep Support, and we discuss the signs and symptoms of Group B Strep, how to get tested, and prevention methods to empower you throughout your pregnancy and beyond. Well, in this episode, we are joined by the fabulous Jane Plumb. She is the founder and CEO of Group B Strep Support, and I have known Jane for a very long time, and she's a huge inspiration to me. She's achieved so many wonderful, wonderful things, so I really aspire to be like Jane. So no pressure, Jane, for this podcast. But for the listeners that don't know who you are, please introduce yourself and let them know all about you, and what you do and how you came to found the charity.
Well, thank you. I'm not sure I can live up to such an amazing introduction, and I'm glad this is a podcast because you can't see I'm blushing. So thank you, Heidi. My husband and I actually set up the charity Group B Strep Support back in 1996. Sadly, our middle child had just died from a Group B Strep infection. And like still actually so many families today, when the neonatologist said, we think that Theo's death was caused by Group B Strep, we went, what is that? We had literally never heard of it. So Robert and I spent some time, as you can imagine, trying to understand what had happened and why it had happened. And when we discovered that most Group B Strep infections in newborn babies actually can be easily and cheaply and safely prevented, we decided that we'd amassed a load of information and we wanted to do something to try and stop it happening to other people. So the Group B Strep Support was born, and we pulled together an estimable medical advisory panel, because we're not medical, so we needed expertise from obstetricians, neonatologists, microbiologists, paediatricians, etc., to help us make sure that we could provide high quality, accurate information to families, which was how we started, but also to the health professionals who were looking after those pregnant women and people, and the new parents, so that we could make sure that the health professionals had information to provide to the families in their care, so that they could stop it happening as far as possible. So that was back in 1996, started on the kitchen table, as it were, and over the years the charity has grown, and we now employ 6 staff, and it's not quite a kitchen table operation anymore, although much more kitchen table since COVID, although we also work in an office, and although we do some of the things differently, the tenets of what we do, the pillars of what we do have remained the same. So it's all about raising awareness amongst new and expectant parents, educating and informing health professionals about Group B Strep, campaigning for better prevention, diagnosis and treatment in the UK, and supporting research into better future prevention of Group B Strep infection.
What an incredible story. So it's coming up to almost 30 years, just shy of 30 years. Wow.
Yeah, I don't think if you had told us back in 1996 that you'll still be doing this in 30 years' time, I'm not sure we would have believed it.
No, it's amazing. It just goes to show what a continuous need there has been for it.
Sadly, yes, and in a number of in many high-income countries, the rates of Group B Strep infections in babies is much lower than it is in the UK. And that's a lot to do with the way prevention is done in other countries compared with the UK. Although we are working and hoping that will change in the not too distant future. So for as long as better information is needed, better education is needed around Group B Strep, and fundamentally fewer babies developing the infection is happening, then there is still a need for Group B Strep support.
Thank you. We'll get a bit more into that, perhaps the difference between the UK and other markets. Before we start getting into that, I'd love to know a bit more. Can you just bring it back to basics? What is Group Strep B?
So Group B Streptococcus, or
B Strep, sorry, Group Strep B. I'm getting it wrong.
A rose by any other name, not that I would call it a rose, but the Latin name is Streptococcus agalactiae, and the full name is Group B Streptococcus, which is why it's often referred to as Group B Strep, because it's a bit of a mouthful. It's a common bacterium that lives in typically the lower intestines of around somewhere between 20 and 40% of adults in the UK. It's perfectly normal and natural there. It's what's called a normal body commensal, and rarely does any harm to the person who's carrying the bacteria. However, the reason that Group B Strep support exists is because GBS is the leading cause of severe bacterial infection in newborn babies, causing sepsis, pneumonia, and meningitis. And the most common cause, in fact, of meningitis in babies under 3 months. When somebody is carrying Group B Strep in their intestines, it's not uncommon for the bacteria to migrate and also be in the vagina. So it's in the Group B Strep is in a really good position for late in pregnancy, for a baby to be exposed to the bacterium, typically just before or during birth, as the baby, the bacteria can either ascend from the vagina to the baby, or as the baby is being born. And most babies, when they're exposed in that way to the bacteria, will shrug it off without a problem, thankfully. But unfortunately, some babies, and we don't fully understand why, some babies, when they're exposed to the bacterium, can't shrug it off and they go down with serious infection. And in the UK, approximately 2 babies every day will develop a Group B Strep infection. And thankfully, most of those babies will fully recover, but 1 baby every week will die as a result of their infection, and 1 baby will recover with life-changing disabilities. So it's really important that where we can, we prevent, because of course, prevention is better than treatment.
So what can you do to prevent that risk? How, if I knew I was carrying Group B Strep, how would I be able to reduce the risks of that passing on to my baby?
If you know you're carrying Group B Strep, then when you're pregnant, then current guidelines all say that you should be offered intravenous, so through a vein, antibiotics from the start of labour and then at regular intervals until the baby is born. And that is hugely effective preventative medicine. Research from other countries has shown that that reduces the risk of a newborn developing Group B Strep infection by over 80% when it's provided to people who are carrying Group B Strep as they give birth. And the antibiotic that's normally used is penicillin, so it's one of our safest and most tested antibiotics that we use. And for people who are allergic to penicillin, then there are alternatives. If you don't know whether you're carrying Group B Strep, then the UK at the moment uses a risk-based policy whereby if certain risk factors occur either before or during that pregnancy or in labour, then the IV antibiotics will be offered. And those risk factors are having previously had a baby who developed a Group B Strep infection. If Group B Strep has been found anytime, any place during the current pregnancy. So that's if it's been on a vaginal or a rectal swab, because that's where you look for Group B strep, both the vagina and the rectum. Or if you have a urine sample. Group B strep is a cause of urinary tract infections. It's not the most common cause, but it is a cause, so it might be picked up that way. Also, if you go into preterm labour, so if you start labouring before 37 completed weeks of pregnancy, then the IV antibiotics are recommended in that situation rather than just being offered. And that's because both because preterm babies have a higher rate of Group B strep infection than term babies, and also the consequences, the outcomes are poorer for preterm babies. So that there are a number of risk factors that, even if you don't know whether you're carrying Group B strep, they should be identified by your midwifery team, and you should be offered the IV antibiotics if any arise.
Thank you. Is there any kind of like standard test, or is it solely based on the factors that you just talked about? So if there's been kind of those indications in the past, or
a good question, thank you. That there is a one recommendation from the Royal College of Obstetricians and Gynecologists guideline, that if somebody carried Group B strep in a previous pregnancy and the baby was well, then in a subsequent pregnancy, they should be offered a test for Group B strep. And they are very specific about what tests should be offered, because Group B strep can be quite difficult to grow using a standard vaginal swabs. I think most of us are used to a high vaginal swab, and if you use that, it's not particularly good at picking up Group B strep. So the test that's recommended by the RCOG and also by the UK Health Security Agency, is often called the ECM, Enriched Culture Medium Test. And what that test is, it's taking swabs from the low vagina and the rectum, and then those samples are processed in a lab using an enrichment technique, which helps the Group B strep to grow. And again, research has shown that if that test is done within the last 5 weeks of pregnancy, it's hugely predictive of whether the pregnant woman or birthing person will be carrying Group B strep when they give birth, and whether IV antibiotics should be offered in that scenario. So that should be offered, but we know from some research that was done a couple of years ago that quite a lot of hospitals weren't using that ECM test. So it's really important that if an NHS hospital is offering a test for Group B strep carriage, that people make sure it is an ECM test, make sure it is a low vaginal and a rectal swab, and then the culture is not just putting it on a agar plate, it's also using that additional enrichment technique. And I should point out that the ECM tests are available privately. So if somebody either doesn't qualify for an ECM test within the current guidelines, or for whatever reason their hospital isn't able to offer it, or they would prefer to do it themselves, then if you go to our website, we list organisations that we know follow the requisite guidelines on how to test for Group B strep, and the cost is currently around about £50, something like that. But the testing window is 35 to 37 weeks of pregnancy. That is the time that if you're looking for Group B strep to find out whether you're likely to be carrying it in when you give birth.
That is so helpful, Jane. That is really, really helpful. So I'm just thinking, if I was pregnant and I had no risk factors, and I wasn't offered a test or anything, obviously I could go onto a website, find out who offered the ECM tests. Is it quite easy for me to do it myself at home? And then how quickly do you get the results? And I'm thinking, if I got a positive or a negative result, what should I do then?
Oh, lots of questions, fabulous ones as well. Thank you, Heidi. So yes, you can order online, and it is the quickest and cheapest way to do it. And the pack comes with 2 overgrown cotton buds, so one for the low vagina and one for the rectum. I don't think there's anything that's particularly easy to do when you're 35 to 37 weeks of pregnancy, honestly, but it is just as reliable you taking the samples yourself as asking your health professional to do it. And we know from helpline calls at Group B Strep support that sometimes people will ask their partners to take the swabs for them. But actually, it is easily within the realms of possibility, and quite a lot of people prefer to take them themselves rather than asking their health professionals to do it. And then you send it back in the envelope provided, and that happens, the first class delivery, and then the lab undertakes, the labs that we list on our website, they undertake to get the results to you within 3 working days of receiving your swabs. And if you obviously make sure you give your mobile phone number, because they will text the results to you, and that's clearly the quickest way for you to get the results without having to worry about postal systems. And if you get a positive result, that there is an option when you fill out the form to include the details of your midwifery team, so they can be informed of the result pretty much as you are. That's not a requirement, but you absolutely can. Either way, it would be really good if you get a positive result, to contact your midwifery team and say, I've just done a test, the result has been positive, where do we go from here? And what that should mean is that you will be offered IV, you'll be put on a pathway where you'll be offered IV antibiotics when you go into labour. If you want a water birth, or if you want to be walking around or during labour, it shouldn't impact that. There's no reason why it should. The only thing it might change is if you were planning a home birth or birth in a freestanding midwifery unit. So while obviously consultant-led units and the alongside midwifery units are used to providing IV antibiotics in labour, it sometimes can be more difficult for those to be given at home or in a freestanding unit. So do discuss that. Discuss that with them, and so then when you go into labour, you're given a cannula is put either in your hand or your arm, and then from the start of labour and at typically 4-hourly intervals, you are topped up with a dose of penicillin, and then once the baby is out, squalling, fit and healthy, then the cannula is stoppered and no more antibiotics needed. If the result comes back negative, then absolutely, tell your midwifery team, but there's less urgency about telling your midwifery team.
Thank you. That's so helpful, especially around the cost of getting it done privately, because I think when you see that, you automatically think it's going to cost a fortune, but £50 if it's something that you're worried about, and perhaps could be a natural cause after people listening to this to be inclined to do it. It sounds incredibly worthwhile.
Yeah, and I think it's one of those things that if you're carrying Group B Strep and you don't know about it, there's nothing you can do. Whereas if you're carrying Group B Strep and you know you're carrying Group B Strep, then there's an opportunity to think about what you do. I'm a passionate believer in informed choice, but you can't make choices if you haven't got the information. And we hear on the helpline all the time from families who pretty much want antibiotics in labour regardless, and clearly that's not good idea. We need to be using antibiotics when they are helpful and going to make a positive difference, so which they are very likely to if you're carrying Group B Strep. But we also hear from families who don't want to have antibiotics in labour, and that's about making a risk assessment for yourself and making a decision about what's right for you. But if you know you're carrying Group B Strep, then you're making more of an informed decision than you would if you just don't know.
Yeah, exactly. You talked earlier a bit about, I think I cut you off, you mentioned the UK versus some other countries, and the UK being a bit higher in terms of rates. Can you explain the reasons for that, please?
Yeah, the UK rates are approximately double the rates in the US, for example. And the US introduced screening, offering testing to pregnant women at initially 35 to 37 weeks, now 36 to 37 weeks of pregnancy, with the offer of the IV antibiotics in labour for those who test positive. Plus the offer of IV antibiotics to those for whom there was no test result available, but risk factors were present. And they introduced that as a dual option back in 1996. Obstetricians were offered the option of either testing or using a risk-based approach on its own. Most went with testing, but some went with risk-based, and then they did some analysis on that, on those data very cleverly. And then a couple of years later came out with research that showed that there were 50% more cases of Group B Strep infection in newborns if you were using a risk-based approach rather than using the testing approach. So in 2002, the US went, the recommendation is everybody should be tested. And their rates fell by over 80%. And I kind of want that to happen here, frankly. And their rates came down hugely for the newborn babies, and have stayed low. So that has consistently stayed low. So it's not only that it worked to start, it is continuing to work. And other countries that have introduced test-based prevention strategies have all seen their rates fall. Most high-income countries now offer antenatal testing to all pregnant women. Typically, it's the low to middle income countries that offer a risk-based strategy, and the low income countries sadly often do nothing. But yeah, that's the hierarchy of prevention approaches at the moment around the globe. There's work being done at the moment to develop a maternal vaccine against Group B Strep, which would be given at some point. The details need to be worked out, based on the research, that would be given sometime mid to late pregnancy, and that will prevent even more cases of Group B Strep infection than testing will. But sadly, that's a ways down the line, and we have the option to do testing now.
See, this is why you inspire me, Jane, because your campaigning and your determination and resilience is just incredible. Because obviously you've been campaigning for this standard testing for years and years and years, and that's why I just think you're so amazing. But you must be getting closer now, hopefully.
Yes, and as I think you will know, there's been a huge trial that's been going on for the last few years called GBS3, and that is it was a bit affected, shall we say, by COVID. So we had hoped we'd have had the results by now, but sadly not yet. And it's a massive trial. It's about over £4 million trial, funded by the NIHR, which is the NHS research arm, effectively. And that is comparing the risk-based prevention strategy with test-based prevention in the UK. and that's covered 71 hospitals, half of which went to the risk-based policy, and the other half was split between testing at 35 to 37 weeks and testing in labour, so two different testing types. The recruitment of that is all finished, and at the moment the numbers are being crunched. So we are expecting the results of that to be published next summer. And the UK National Screening Committee, which is the body that recommends for or against screening policies, have committed to looking at the evidence coming out of that trial and reviewing their GBS policy once it's published. But it's a massive trial. It's 320,000 pregnant women and people and their babies. So the numbers are going to take a little while to crunch.
That's amazing. Like, yeah, when that comes out, yeah, you must have so much resilience on this, because like, the testing works and the antibiotics work. So to see other countries doing it, and the trial will be amazing, but I'm sure it will just reinforce what you already know.
Yeah, thanks, Marissa. And I'm determined. Never get in the way of a determined person, particularly if they're a female. But yeah, I mean, nobody is expecting really that the risk-based prevention is going to be better at preventing Group B strep infections in babies than either or both of the testing arms. But it has been necessary to have UK-based research demonstrating it for change to happen. So I'm incredibly hopeful that change will happen. At least it will all be set in motion next year, and hopefully it can be acted upon really quickly, because in the meantime, babies are getting sick and dying when they absolutely shouldn't be.
So we've spoken a lot about prevention in pregnancy, but what are the signs of Group B strep infection in my baby? Say I've just had a newborn baby, what signs should be looking out for to see if they've got an infection?
Well, I think as a parent, mothers and fathers study their baby really carefully. There is nobody that watches our babies as much as we do. So I think a golden rule is, if in doubt, check it out and mention Group B strep when you do, because Group B strep is the leading cause of severe infection in babies. So mention it anyway. But the key signs of infection are grunting or noisy breathing, having difficulty catching their breath, seeming to be working hard to breathe. They may also be very sleepy or unresponsive when you try and wake them. They can also be crying, inconsolable crying, just nothing you can do can stop it. They just, bless them, keep on crying. They can also be floppy. They can be disproportionately not keeping, not feeding properly, not keeping the milk down, and they may have an unusual temperature, either high or low, either way. And it may not be all of those, it may be some of those. There isn't one specific sign that means it's definitely a Group B strep infection. But if your baby is not well and not getting any better, then do not pass go, do not collect $200. Get that baby seen by a health professional. Yes, health professionals are busy, but they would much rather see a healthy baby unnecessarily than miss a baby that's sick. And they are very keen to put new parents' minds at rest. I should mention, we've talked a lot about Group B strep infection in newborn babies, and roughly 60% of Group B strep infections in babies occurs in the first 6 days of life. So they're very likely to be under midwifery care, so you'll be able to see their midwives quite easily. Having said that, 40% are described as late onset Group B strep infections, and they occur from 1 week up to 3 months. After 3 months of age, these infections, late onset Group B Strep infections, are really very rare indeed. And the reason for flagging that is the symptoms would be very similar, potentially very similar, but also could encompass signs of meningitis. And I think as parents, we're often told about the signs of meningitis, which are all of the ones I described. Plus, on top of that, there's the not liking bright lights, the stiff neck, and the bulging fontanelle, so the soft spot on top of the head, and maybe sort of jerky movements, sort of maybe having seizures. And it's equally important to, if in doubt, check those out as well, because while the IV antibiotics in labour will prevent most of the early onset Group B Strep infections, those occurring in the first week, by the time a baby gets to a week old, those antibiotics are flushed out of its system, so they don't have a protective effect anymore. So recognizing the signs, seeking early attention, and early diagnosis and early treatment is hugely important. And if you would like to signpost people to our website, there's a handy sort of one-pager that has the signs of early onset and late onset Group B Strep infection on it, and you can print it out and stick it on your fridge.
Oh, that's brilliant, and that's really important. So if you have the antibiotics in labour, your baby still could develop Group B Strep later on. Is that what you're saying?
Yeah. Yes, and the babies still can develop early onset Group B Strep infection, because we're reducing the risk by 80-odd%, but that still leaves the 20% that might still develop the infection anyway. So I think as new parents, it's just keep an eye on your baby, like you would do that anyway, for goodness sake. And if you're unsure, if the baby seems to be poorly in any way, have a low threshold for checking it out, and do mention Group B Strep when you do. And if Group B Strep has been detected during your pregnancy, or if you've previously had experience of Group B Strep, do make sure your health professionals are aware of that.
Thank you. I think that's so important. Babies are so delicate, aren't they? Little things that, like, sometimes you hesitate to take them in, but the reality is, like, even if you do and they're healthy, then everybody loves a cuddle and to say hello.
Yeah, and I think it's a very British thing that we do, which is, we don't want to be a bother, or they've got more important things to do, other people are more important. No, other people are just as important as you are, and you and your baby are really important. So just check it out.
Thank you.
Absolutely. Well, July is Group B Strep Awareness Month, so I'm sure it's absolute manic at your HQ. So tell us what you've got coming up this month.
So during July, we are focusing in the first week in encouraging everyone to do bake sales, and bake sales are, who doesn't like a bit of cake? I know I do. Mine's lemon drizzle, if anyone wants to know. So and it's a great way of both raising money for the charity. The charity, like all charities, we can only do what we do with support. But it's also a great way of raising awareness about Group B Strep. It's pretty much impossible to do fundraising without awareness raising combined. So we're encouraging everyone to get involved, get in touch with us for a bake sale pack, and have a fabulous bake sale. Send us your pictures so we can share on social media, and so we can spread the word. There'll be a lot of activity on social media. So if anyone is on Facebook or Twitter or Instagram, or indeed LinkedIn, please do go and search for us, Group B Strep Support, and follow us. We will be releasing results of a new survey, which is being conducted the week of the 24th of June. So that will be brand spanking new statistics to help us understand better the level of awareness of Group B Strep in pregnant women and people, and in new parents. So we will be releasing those data.
It's exciting. Did I cut you off? Were you about to ask? I was just going to ask you, what else did you want to add? Is there anything else that's come out?
A great question. Very excitingly, we have been working hard on an e-learning module about Group B Strep, which will be aimed at both midwives and other health professionals involved in maternity and neonatal care. It's going to be quite a short module. We think around 30 minutes. It's not quite finalized yet, but please know we will make a song and dance about it as soon as it is available, and it will take through a lot of the information that we've shared today, but also a bit more detail, and with links for downloads, links to the latest guidelines. The module is based on the Royal College of Obstetricians and Gynecologists clinical guidelines, and also the guidelines from NICE. So that will help equip midwives better with the information that they need about Group B Strep, and help them to pass that information on to the families in their care. We're going to be hosting it on our website, and it is going to be free for people to use, and it will be CPD accredited, so it will be great for midwives to get that little extra CPD that they need. So yeah, thank you for asking. I'm so excited about this.
That is mega exciting, and Mama Academy will put that on our website, and we will also help spread the word in our e-newsletters and social media, etc. So yeah, we'd love to share that with you, because that sounds a valuable resource for healthcare professionals.
Thank you so much. Really appreciate that.
Thank you, and thanks for joining us. It's been an incredible conversation. I learned a lot, and there's lots for our listeners to take away. So thank you so much.
Thank you, Jane.
Thanks for inviting me.
Continue to be inspiring and incredible as always.
God bless you. Thank you.
Take care.
Take care.